Hi, hello. I'm Bharti Khurana. I'm an emergency radiologist at the Brigham and Women's Hospital, associate professor at Harvard Medical School. My area of research is on vulnerable population. So the first project was on intimate partner violence. Intimate partner violence, as we know, it's physical or sexual violence between current or former partners. It's not just physical, sexual, actually, it's a lot more than that. It's also verbal, psychological, financial. So many things can be included in intimate partner violence. And, so it's the physical injuries we see in these patients. And often these patients come to us because of trust. They trust their healthcare providers. So they talk to us, share their personal stories before reaching out to social workers or law agencies. And this is the reason we screen for intimate partner violence among our patients. We check whether they are safe in their current relationship or if there are injuries related to any violence they are facing at home. But the reality is that screening doesn't happen for everyone. Often we are so busy, especially primary care physician, orthopedic surgeons, where these patients often go with their injuries, that they don't have time to ask this question every time. And the way this question is also asked, there is no eye contact. It's just like a quick thing, like, are you safe at home? And then answer is, yeah, everything is good. And then they just move on. So as radiologists, we can see the stigmata of injuries. So not just current injury, but also past injuries. And we have access to all radiological studies. So, and this is what we did last 5 years. We have defined various injury patterns. So for example, face is often the target. So you have facial injuries. It can be just soft tissue swelling or fractures. And then as you are preventing or trying to save that, trying to escape that force on your face, you are actually raising your arm, hand, and end up getting defensive injuries. And that may happen at the same time or other times, but we would see that stigmata on radiological studies. Also, because these patients come frequently for imaging, we have a lot more imaging studies done for patients who are reporting intimate partner violence compared to patients who don't report IPV. And as a result, we can simply see, I always give this example of a woman who was injured when she was 25, then she came back again at age 38, and in between she had 68 radiological studies, not just musculoskeletal, but also like cardiac and, because there are so many adverse effects of domestic violence. And then she also had like two, we call it pan scans, when you image someone, CT, head, cervical spine, chest, abdomen, pelvis. And you can imagine, like, being so young, getting all these studies done. And I didn't even count the number of appointments she had at my institution. So non-imaging appointments. So, but there are all these patterns. Sometimes injuries, they are stating fall, but the injury pattern is not going with fall. So this is what we have learned, over the last 5 years, different kind of research, looking at injury patterns, which can actually help us identify intimate partner violence.
And what is your message then to the profession, to individual radiologists as well? What should they be doing? What can they be doing? And what stops them from doing it?
Right. So definitely we have access to all historical imaging data, and we can actually look at the injury patterns which are specific for intimate partner violence and raise suspicion. So that's an ideal world. When I have a lot of time, I can look back. But I understand, like, even I feel guilty. If I'm reading a wrist x-ray, if I spend more than a minute, I'm already feeling guilty because I know the list is long. I have to move on to next patient who needs my urgent attention. And this is the reason I brought AI. So it would be great if we have an AI tool actually highlighting what are the radiological studies which are showing injuries. Then I can quickly look and use my understanding of intimate partner violence injury patterns and raise suspicion. So that would save my tremendous time. The other thing is we just built this tool called AIRS, Automated Intimate Partner Violence Risk Support. It's a system. It's just now not only identifying patients who are at risk for intimate partner violence, giving actually quantified risk probability for every patient at the point of care, but it's also coming up with caring conversations, how to talk to these patients, guides for the patients. So yeah, I'm actually trying to help radiologists using this tool so that when they are busy, actually right now radiological studies keep me very busy. I hardly have like clean list. There's always something to do. So I'm hoping with that tool, one can get the information on quantified IPV risk probability, and the tool can highlight which radiological studies are positive so that they can simply look at the radiology reports and then raise suspicion for intimate partner violence with the clinicians.
Thank you so
Oh,
much.
thank you.